I'm Kristen Adair, and this is my journey to surgical correction for my Pectus Excavatum. This video is actually long overdue. This is for all the females out there. I just kind of wanted to talk about the other side of my surgery, which was the plastic surgery part. So basically, growing up, I was always a little different, and then I had my first gynecologist appointment at 16 where she told me that it was just cosmetic, that I had the pectus excavatum, so not to worry about it because it was just cosmetic, so I knew I had it. However, as I got older, my appearance I didn't like so much because I was completely uneven in my chest. So one side was a complete different cup size than the other in a bra. You know how everybody says that girls have one that's a little bigger than the other? Well, in this case, it was not just a little bit, it was an entire cup size. So as you can imagine, nothing fit, bras, bathing suits, top, nothing. So that wasn't very fun. And at 21, I decided that I would go ahead and get a breast augmentation to fix that. So I went ahead and did that, and my plastic surgeon was wonderful, and he fixed it. So everything was even, and it ended up being about 75 cc's difference in each implant. But then I was even, so I was very pleased with my cosmetic effect. And then as you guys probably know if you've watched my other videos, that worked for a while until I started having all the other symptoms that were not cosmetic. So all the heart problems and the lung problems and etc. So unfortunately, that was just a quick fix. So once I did my CT scan, if you see the picture, you can see it on there as well. The plastic surgeon on my implants, he actually had one that was facing straight on right here and one that was right here. And that's just how he had to do it because of the way my chest and my sternum was tilted. So my implants were sitting not like how a normal person would sit. So that's what he had to do to make everything look good. And you can see that in my CT scan. So once I went to the Mayo Clinic and met with Dr. Jarzewski, she wanted me to meet with Dr. Rebecca, who's a plastic surgeon that she works with. And basically we discussed options. And so Dr. Rebecca told me, now I can't speak for everybody, remember, this is just me, my opinions, and what I was told for my case. So everybody's going to be different. So basically Dr. Rebecca said I had some options. So she said, well, first option is she can just be standby in the operating room and have Dr. J just work around my current implants, which Dr. J said she could try to do. She's done it before. So Dr. Rebecca would be on standby. And if for some reason Dr. J entered the implant pocket or ruptured the implant, she would jump in and do what she had to do to fix the problem. If she didn't enter any pockets or rupture any implants, then Dr. Rebecca wouldn't be needed at all. So if that was the case, at the end though, you have to remember I wasn't even to begin with and I have different size implants. So if Dr. J was to go in and work around the implants and do everything just fine, no rupturing, no entering the pockets, I would now be even, so now my implants would make me uneven because they're different sizes. So then Dr. Rebecca could go in after that and just fix one implant to make it even with the other one. Complicated. It's kind of confusing, so I hope you can follow along with me because it was confusing for me as well. There is a very high chance that if she enters the pocket, you could get infection in your implant. So that was my option, or I could just have Dr. Rebecca go in first, remove my current implants, then have Dr. J do her surgery, then have Dr. Rebecca come back in and just put 2 new implants in. Or I could just have her remove my implants, have Dr. J do her surgery, and not put new implants in. But when I started out, I was a very, very small A, so I've become accustomed to, I was a B cup prior to my Nuss procedure, so I've become accustomed to that, and I didn't really want to change that. So I had a lot of time to think about it, and I chose the option to have Dr. Rebecca remove my implants first, then have Dr. J do her surgery, then have Dr. Rebecca replace new implants. And I had saline implants prior, and I chose to go with the silicone gel that both Dr. Rebecca and Dr. J recommended for me. So that was the option I chose. And with my surgery, everything went well, and Dr. Rebecca went in, took those implants out, and Dr. J did her thing, no problem. She didn't have to. I wanted to have, Dr. J said she had no problem working around the current implants if they're in there. She's done it before. She knows what she's doing. She's an expert. But the main part of this surgery, the most important part was Dr. J's part, because that's what my life depends on. She's helping me extend my life by that surgery, and so I just wanted to have everything removed. I didn't want to have a chance of her hitting a pocket or possibly rupturing the implant or having to work around anything. I wanted her to have a clear shot, nothing interfering with it, and just that's just my opinion. So that's what I chose. And so like I said, Dr. Rebecca came in at the end and put her implants in. And so everything's even. I have the silicone gel implants now, and Dr. Rebecca was able to use the same incisions that Dr. J used, which is awesome. She said that was what she would try to do if she could. If she couldn't, she'd have to make her own incisions. So I got lucky, and she used the same incisions. So I have just the 2 incisions on each side, and everybody used the same ones. And Dr. Rebecca put in JP drains, one on each side. So I had, that was just draining blood. And she said she started doing that because there's just so much swelling that you get in your chest with Dr. J's surgery that she didn't want to add to the swelling with her surgery, so her part of the surgery, so that's why she decided to start doing the drains, and that was just to keep the swelling down in the chest. So I had those drains, and if you watch my other videos, I had to go home with those, and everything went well. And I think that's all I wanted to say. I just kind of wanted to get that out there for the females because they've had a lot of questions about implants. And when I first started researching everything, I couldn't find anything online about females who have implants going into the Nuss procedure, whether or not they'd have to go to a plastic surgeon first, have all of that taken care of, then go to Dr. J, then go back to a plastic surgeon and wait some amount of time. And that was really scary because I didn't want to have this drawn out for years, multiple different surgeries, different surgeons, and it was very easy, and I was very happy that it was one surgery, one recovery, and it was all done for me. So it was great, and I hope that helped anybody that was wondering. If you have any questions, please ask me. I have no problem answering. But I think that's it, and I will talk to you soon. Bye.